What's up, guys? Welcome back to my channel. Today we're going to go over you getting to the hospital. So congratulations, you've made it to the hospital, and the hardest part is now over. So today we're going to talk about what you should expect from the moment that you walk in. You're going to meet your heart surgeon. You're going to meet a couple of anesthesiologists. If you have any final questions, now's the time to ask them. But your time with them is going to be very brief. Stick around, and we're going to get into it.
Ooh, all right. Woo. This is light work. Come on, spill the tea. Yeah. Ooh.
All right, getting into it. So I would fully expect fear to kick in at this point. Okay, you've had fear all this time. It's really going to inflate at this point. It's okay. Let it loose. Cry, be upset, be afraid. It's very normal. Just understand that you're in a controlled environment. They control your body, and you're going to wake up. I woke up. You're going to wake up. And you need to remember that. So if you have any final questions, now's the time to ask, your heart surgeon or, some of the anesthesiologists or even the nurses. Just ask some questions. Okay, make sure you remember, you're in a controlled environment. Sometimes people will remember little blips here and there as you're waking up, intubated with the tube in your mouth. I remember probably just a couple of seconds of it. Other than that, your job is just to sleep. It's to sleep and to heal. It's the only way for your body to heal is to get some sleep. So just relax. The hard part is over. The surgery is done. Now everything is downhill from here. Okay, during the time that you were intubated and they have you in the ICU, that's when the surgeon's going to come out, talk to your family, let them know that your surgery went fine, everything went as expected, or if they had to tweak something, or if they seen something that they didn't catch in a test before, and they went ahead and addressed it while they were in there. That's all a good thing. That's not a bad thing. Okay, they're probably going to get you up into a chair. All right, they want to get you up, get you moving. So don't panic. You may not even remember waking up and getting into a chair. I think I slightly remember swinging my legs over the end of the bed. I don't remember too much. But again, sleep. It's over. Now, remember, it's all downhill from here. Don't push yourself. Don't push yourself for anyone. Just sleep. Okay, you're going to be very tired. It's normal. You have a lot of anesthesia in you, and it's got to get out of you. Don't panic if you start to look around and you see that you're hooked up to a ton of IVs. You have a PICC line out of your neck. Don't panic about all that stuff. You can't feel it. They put it in you when you were asleep. It's normal. And trust the system. That's the best thing. Just trust the system. They do this every day. So just trust it. Getting into day number 2 or day number 3, depending on what time your surgery was, don't be shocked, but you're going to get some physical therapy, occupational therapy coming in your room. You're going to be visited by a respiratory therapist. So occupational therapy, what they're going to do is they're going to try to get you up and they're going to get you walking down the hall. Okay, yeah, don't be shocked if you can't make it all the way down the hall. Do what you can do. You get down the hall, you're going to come back and you take a nap. You walk, sleep, walk, sleep, walk, sleep. The goal is to walk just a little bit further every time you do go walk. Just a little bit further, take a little extra, couple more steps is what you need to do. Just take a couple more steps. Don't push yourself too hard. And don't be stressed. You're not failing at anything. Everybody heals at a different rate. So key is if you want to walk, you want to get out of there, get up and walk. If you don't walk, you're not going home. I'm telling you right now. So walk. Now, the respiratory therapy. They're going to come in and they're going to bring you like a spirometer. Remember, that isn't something that you blow into. It's something that you suck air into. So when you're doing that, you're inflating your lungs. You're trying to get some of that fluid that's built up in your lungs out. You'll do that by coughing. Don't forget your heart pillow. Hold on to that heart pillow when you cough. Occupational therapists and physical therapists are going to kind of set a goal for you, whether they want you to walk once a day, twice a day, or 3 times a day. Just make sure you get up and do that. If you don't, they're going to be on your ass. Okay, they want you up and moving because getting that circulation going is really good for you. Okay, And remember this, all the fear is gone at this point. So it's just all about healing. The most common questions that I usually get is intubation. Am I going to remember it? Pain. Okay, pain. Let's just be honest. It's going to hurt. Okay. Now, for me, and I can only speak for me, is it didn't hurt so much in my chest as it did in my back. Excuse me, it did hurt in my back quite a bit. But pain, right? It's number one, it's temporary most of the time. But it's going to be temporary for you. And pain lets you know that you're still alive. So pain is good. When you're walking down the hallway, it's going to be uncomfortable, especially for the first 2 to 3 days. And that's mainly because the drain tubes that they have in you that drains the fluid down into like a little canister. I have no idea what it's called. Those are not very comfortable. You got to love, doctor's terminology. You're going to feel a little pinch or pressure, right? Yeah. We all love when we say you're going to feel pressure. No, it hurts. I know it does. And it's going to hurt for you too. But 2 to 3 days after that, they remove those tubes. And man, when they do, it is just a sigh of relief. Huge sigh of relief. So just embrace it. And once you get those tubes out, walking is going to be so much more comfortable. So I'm going to keep this video pretty short. I do want to let everybody know that on Wednesday, February 25th at 7 p.m. Eastern time, since I am located in Ohio, I am going to be doing a live where you can come in and ask some questions, and I'm going to give you honest answers, okay? But I can't give you any medical advice. All I can tell you is, as a patient and as someone who recovered from heart surgery and still recover, I guess it never goes away, but yeah, there's a lot of platforms out there. There's a lot of groups out there on Facebook. There's a lot of groups out there, on chats, stuff like that, where you can ask a lot of questions. I wanted to do a live to where you can look at me, you can ask your question, and you're going to get a direct answer. You're not going to get a delayed answer, 2 hours, 3 hours, because sometimes we want an answer now. And I'm going to give you honest answers. So if you have not done so, please like, share, and subscribe to this channel. It's going to notify you when the live is. And please share it. Share it with anybody in any platform that you can. The goal is to get the information out there and to help as many people as I can. But for now, I'm out.